cost just $4 per person.
Well, today we're learning more about a common skin condition that affects many children. Dermatologist Dr. Marlene Detock joins us in studio to talk about eczema. So thank you very much for coming in.
Thank you very much for having me, Marnie.
So what is eczema?
Eczema, otherwise known as atopic dermatitis, is a chronic and relapsing skin condition characterized by inflammation and itch. It is hereditary, not contagious, and most children outgrow it by puberty.
Okay, so does it just look like a red rash, or what does it look like on a child?
Yes, it's red rash, poorly demarcated. In young children, it usually appears on the face, extensor or outer arms and legs, and then it becomes more flexural, so in the bends of the arms and legs as the child gets older. And then in adults, it can even be more localized just on the eyelids and the hands. And more importantly, it's characterized by itch.
Okay, and it's generally kind of flaky too, isn't it? Sort of dry-looking skin?
Yes, dry-looking skin.
And if your child's itching at it, then it's a good hint that that might be eczema.
That's right. And eczema also is usually accompanied by other atopic diseases, such as hay fever and asthma.
Okay. Now, does eczema get worse in the wintertime, or is that a myth?
Absolutely, Marnie. Dryness drives eczema. So we have to really work on bathing and moisturizing of the skin to prevent the flares of eczema. And that really goes into our ABC of eczema management.
Okay, so what are the ABCs?
That's right. So A is a daily skin routine of bathing and moisturizing. B is being patient, and that's very important, especially for children. They need a lot of care and attention. And C is for conversation with other parents, teachers, and even children on how they can help in the care of children with eczema. And I feel that C should also stand for catching inflammation early. So before they get weeping, oozing, and even infected, we should go and apply those medications as the doctors prescribe regularly before it gets worse.
Okay. And treatment just is a lotion that you put on, is it not?
Usually there are topical treatments of creams and ointments that the doctors prescribe, but there are systemic agents for more recalcitrant forms of eczema. And bathing and moisturizing is key, as I mentioned. Ambient humidity should also be paid attention to, and drinking lots of fluids.
Okay, so bathing, you know, you hear sometimes that bathing in certain soaps can be drying to the skin and then making it worse. So is there something you should do specifically while you're bathing, and is there a specific moisturizer, or what's your best bet there?
That's right. There are different brands out there, and generally speaking, bland emollients. So products that are void of alcohol and other irritating substances, perfumes that delicate skin may react to should be avoided. And the same goes for soaps and soap substitutes.
Especially with the baby products, because they do smell so good, but they're not necessarily best for baby skin.
That's right.
Now, how difficult is it for parents of young kids if they're scratching? You can't tell a toddler to stop scratching. How do you deal with that?
That's right. Distraction is very important, as in other cases when we want to veer away from things that are not good for them. And also, again, the bathing and moisturization routine. You know, the first sign of itch and scratch, pull out your medications and moisturizers, and they are prone to itch less.
And you'd mentioned the humidity. Do you recommend like a humidifier in the bedroom, or? That's
right, a clean humidifier. I find that even over 50% is better for atopic children rather than the 20 to 40% that is the usual.
And you're a mother of a child with eczema, so as well as being a dermatologist, you know this firsthand.
That's right. I mean, fortunately, my child's eczema is mild, and that goes to show that the ABC of eczema does work.
Sounds good. Okay, well, if you need more information, you can check out the Eczema Awareness, Support, and Education Program. You can do that by going online. The website is eczemacanada.ca, and some tips on how to avoid it this dry winter that we'll eventually face. Thank you so much for coming in. Later, an exclusive look at the extreme dangers on Alberta's deadliest highway.